Welcome to the Dermastore podcast.
A chat about all things skincare, skin health.
And if you're a real skin nerd, we hope you'll join the conversation. Welcome to our third episode. Hey Lara, how are you doing?
Good morning, Greg. I'm well. How are you?
Very well, thanks.
Good. How important is today's topic?
Yep, it's a big one. So we've actually have two pregnant ladies in the Dermastore team at the moment. One being my wife Sarah, and then Mieke, one of our skin therapists. Both imminent arrivals in March, both girls.
Very exciting to have two little new skin junkies join the team.
Before we kick things off, let's do our tradition. What did you use this morning?
Our routine, I use Mesoaesthetic Brightening Foam Cleanser this morning.
Okay.
And it's such an unbelievable cleanser that you can even just take it over your eyes. It doesn't sting or burn, so it's one of my favorite cleansers, and the brightening effect is unreal. And then to continue on the brightening journey, I used La Roche-Posay's Vitamin C Serum. And my moisturizer was Huxley Anti-Gravity.
Awesome.
I love how that moisturizer feels on my skin. And my sun protection was the HelioCare Gel Cream Light, the tinted SPF.
Okay, nice.
Now, what did you use?
I used the Dr. Barbara Sturm Foam Cleanser, which is just a great mild everyday cleanser. And then Dr. Webster cut something off my face the other day very kindly.
Didn't want to ask what was on your
I know, so I've got a plaster on. He thought it was something malicious. It's not. It was completely benign. Anyway, so I've got a bit of a cut on my face. I'm just like a little bit cautious about what I'm putting on. But I've actually been using, weirdly enough, that Isden Oriderm, which is like actually an amazing everyday moisturizer. I know it's for post-treatment and for bruising and scarring.
Greg, can I tell you, I was looking for that product the other day.
Oh, I've got it.
I thought you might have, because I also went for a procedure the other day, and it's such a relevant product when you have these types of procedures.
But I just like it as an everyday moisturizer.
Really?
It's lightweight. I don't know what it is about that product. It's just really nice.
That's great to hear.
Yeah. And then I used the HelioCare 360 Gel Oil Free.
Very nice.
Yeah.
That's your go-to, actually.
Yeah, pretty much.
Okay, cool.
The topic for today is pregnancy and skincare. We're going to talk a little bit about if you have a C-section, post C-section scarring and how to manage scars. And then we're going to talk about baby and newborn skincare and how to get a little one off to its best start with its skin routine.
Yeah, and I think we're going to touch the tip of the iceberg with this one. There's so much to discuss. It's such a big topic.
It's a question that comes up on our sport every single day, maybe a few times a day, and there is a lot out there in terms of information. So joining us in the studio this morning is our in-house dermatologist, Dr. Ian Webster. How are you, Dr. Webster?
No, I'm well, thank you.
Good. So this topic comes up a lot. I think it is very relevant for our customer base. I think we've done emailers, we've done articles, we've worked with influencers on this. Why is it such an important topic?
Well, I think obviously being pregnant, you don't want to harm your unborn baby.
Is that what it comes down to? Is that what it is?
Well, I think there's two things. You have hormonal changes, so you do get pigmentation, you do get flare-ups of your acne, so you still want to look good.
Right.
So you want to use products, but you want to use it safely.
Do you think it's a marketing or a media hype that it started this whole thing, or has skincare always been a concern for pregnant women throughout your years of practicing?
I think it always has been a concern.
Okay.
But I think there's more products, there's more ingredients.
More information.
So I think there is confusion. There's no big clinical trials are done on pregnant women. So we know certain things you definitely can't use. And then a lot of it is anecdotal evidence or animal studies. So it's by inference.
Let's kick it off with the ingredients. There's kind of like three categories. The definite no's, it depends, and the considered to be safe ingredients. So maybe you can just run us through the definite no's.
So the definite no's are the number one, the oral medications like oral retinoids like isotretinoin, Roaccutane or Orotane. Those are definitely no, because those have been proven in the first trimester. You've got a great chance of having an abortion or having an abnormal child. So that's obviously no. Oral tetracyclines you must not give during pregnancy. And then the topical products that are prescription topical retinoids, adapalene, isotretinoin, tretinoin, and topical hydroquinone are also no's. But the other non-prescription retinoids like retinol, retinaldehyde, those should not be used.
Okay, so even the derivative forms of vitamin A, nothing of vitamin A family?
No, basically nothing with vitamin A,
Okay.
either orally or topically.
Yeah, so that's obviously something that, if you are in your 20s or 30s, it might be a product you're using. What if you fall pregnant and now, maybe you didn't know you were pregnant for some time and you've been using the product? Obviously, that's a concern.
Well, this is all theoretical. So there have been reports, especially with tretinoin, which is the retin A, of some birth defects with topical tretinoin. But you just want to play it safe. So I think it's not the end of the world if you've been using a retinol and now you discover you're pregnant. Very small amounts are absorbed into the body. So, but obviously you don't want to use a topical retinoid if you know you're pregnant.
Yeah.
Retinol's quite a hard one to let go of for 9 months.
Yeah, and it applies to breastfeeding as well. I mean,
yeah. Again, we're playing it safe.
Okay, and then we've got the sort of depends upon category, which is your acids. So glycolic acid, salicylic acid. What would you advise?
Well, again, it depends. There's a difference between a wash-off product and a leave-on product. So obviously a product you wash off, it's only staying on your skin for a short period of time. And then a leave-on product. So the products like salicylic acid as a wash-off product for acne, you can use a lower concentration, like 2% salicylic acid as a wash-off product is fine. And if you're going to do a leave-on product with salicylic acid, then you can leave it on, but again, just use it as a spot treatment. So the same as benzoyl peroxide for acne, you want to just use it as a spot treatment.
So you're not applying it over the full face, so it's a smaller surface area that we're applying to. Okay.
Yeah.
Okay, so no creams or lotions or leave-on products with higher percentage of acids, basically.
Exactly.
Okay.
Except as a laic acid, you can use up to 20%.
And polyhydroxy acid.
And polyhydroxy acids,
Okay, well, that moves us on to the considered to be safe list. So I think when we're thinking about skincare and active ingredients, we're always thinking about what concerns we're targeting. During pregnancy, things like hyperpigmentation, maybe acne. So what are the kind of considered to be safe ingredients that could address some of these concerns?
Niacinamide, polyhydroxy acids, purslane that occurs in a lot of the Dr. Barbara Sturm products, vitamin E, hyaluronic acid, azelaic acid with a concentration of less than 20%, peptides, and the mineral sunscreen zinc oxide and titanium dioxide.
And some of these ingredients you've listed, Dr. Webster, are multifunctional ingredients. So, for example, azelaic acid has so many benefits for different skin concerns.
Exactly. Azelaic acid is one of my favorite ingredients because it helps for acne, it helps for post-inflammatory pigmentation, it helps for melasma, and also helps for rosacea and perioral dermatitis.
Amazing.
Which often does occur in pregnancy, in fact.
So there are a lot of options for pregnant women to use active skincare.
I think polyhydroxy acids for me is one of the ones that I think is overlooked because think about a lot of ingredients have that sort of keratolytic action and then you can't use them in a leave-on product, but polyhydroxy acids are considered to be safe. So that's a mild or derivative form of a glycolic acid or sugar-based acid. So that's a great one. Niacinamide, fantastic for brightening and keeping skin radiant and glowy. Hyaluronic acid, always a staple. And then, of course, the sunscreens. The sunscreens topic is a huge one, and especially has come into focus more in the last few years around the safety of sunscreens, specifically chemical sunscreen filters. So we're just sticking to the pure mineral ones now.
Exactly. There's been a question mark over the older generation chemical sunscreens. Those are absorbed into the body. They've been used for years and years and years without any apparent side effects. But the FDA has put a question mark over these and wants further research being done into it. So I think until we've got more information, I think if you want to play it safe again, use the mineral sunscreens.
I think, and what's really wonderful opportunity that we have at Dermastore is just us discussing this. It does already sound quite overwhelming. So it's no wonder why pregnant women struggle with what they can and can't use, because it is a bit confusing. It's quite a complex. There's so many ingredients. There's so many actives. And yeah, just discussing this is already, no wonder we get asked this on a daily basis. I'm pregnant. I have these concerns that I'm struggling with, whether it be acne or hyperpigmentation. I regularly used to go for skin treatments in clinic. Can I continue going for these treatments?
Unfortunately, a lot of them I prefer not to do because with pregnancy, especially if you've got a more olivey skin, there's a greater risk of post-inflammatory pigmentation. So things like deep chemical peels, laser, medical microneedling, or anything where you might need a numbing cream beforehand, I would not recommend using a numbing cream on your face or anywhere on your body for pre-op if you're pregnant.
And also we've discussed your high concentration of these acids is not considered safe.
Exactly,
so
exactly.
Would you consider a facial, just a basic deep cleanse facial?
Yes, that's fine. Okay. It's like a comedone extractions would be fine.
Okay.
I mean, you could do a very mild chemical peel, but I think it'd be safer probably not to do that. Just a facial would be fine.
Awesome.
Moving on to the topic of pigmentation and the mask of pregnancy, we all know it as melasma. What are the sort of things that can be done about it?
Well, number one is prevention, is because the sun can trigger it. So it's sun avoidance, sun protection, and sunscreens. So wear a hat, seek the shade, and then use your mineral sunscreen. So often there's different types of melasma. So often in pregnancy, you get what we call epidermal melasma, where the pigment just comes out in the top layer of the skin. And that's usually not a problem. So it's temporarily while you're pregnant, if you do all the right things, and then often that will disappear spontaneously after pregnancy.
Is that because of the surge of hormones?
It's a surge of hormones, yes. But you can use various products if you want to. Products containing niacinamide, peptides, and azelaic acid. But fortunately for most, but you must be super careful. Most times, if it's an epidermal form of melasma, if you use the sunscreens afterwards, most times it will fade on its own.
Oh, really? I didn't know that. Yeah. All on its own.
Obviously, you've got to use the right product. If you're going to carry on in the sun without sunscreen, it's not going to.
Okay, so it sits in the epidermal layer, and you wear sunscreen, it prevents it from going deeper
into the dermis.
Into the dermis. And the dermal melasma is the tricky one too.
The tricky one. Once it's gone from the epidermis to the dermis, then you've got a problem.
It's amazing what a sunscreen can do.
Unbelievable. And it's been clinically proven. There have been tests and trials on this.
Any supplements to take?
No, I think just the routine sort of pregnancy supplements, the vitamins. I wouldn't take anything else.
Okay.
Yeah.
So, Dr. Webster, most women are on the contraceptive pill for a few reasons, obviously preventative, but also a lot of young ladies are on the contraceptive for their skin to prevent acne breakouts.
Yes.
Okay. But now, what will happen if I go off the pill, because now I'm trying to eventually plan for a baby in the future? My acne is inevitably going to come back.
Yes, so the pill will control the acne, and often if you go off the pill, the acne will get worse. So I see in my practice women with adult acne in the more severe end of the spectrum. We know they're going to struggle. Sometimes it can go on for years. It can continue into their 40s sometimes. If I see them with more severe acne and they want to plan a family, and that's where I do often recommend isotretinoin or Accutane before they plan a pregnancy. So you put them onto isotretinoin or Accutane for 6 to 9 months, and that's the only drug that can put your acne into remission. So you sort the acne out, put it into remission, then you can go off the pill, have your baby, and at least your acne shouldn't flare up too badly while you're pregnant.
Okay.
I've seen a number of women who have struggled with acne, didn't go on isotretinoin, fall pregnant, their skins are terrible and they're miserable, and that's I wish I'd gone on the isotretinoin before the pregnancy.
Wow. And then they're also left with all the other complications that
exactly.
acne
It could
leaves.
be scarring, because once they're pregnant with severe acne, there's not much you can do.
Yeah, we're quite limited, as we've seen with the actives we can use.
You could just use some topicals.
Yeah.
Well, and what are those specifically? Salicylic acid and a wash-off product?
Yeah, you can use salicylic acid, a wash-off product, yes. azelaic acid and niacinamide.
So those in a cream or a spot treatment or anything like that.
Yeah.
And benzoyl peroxide?
You can use it as a spot treatment.
Okay.
Yeah. But usually use it anyway as a spot treatment for the more inflamed, infected lesions. Yeah.
And I think what's really important is to just be consistent, be routine with your skin, and just be patient. I mean, it is a bit of a roller coaster, this pregnancy journey. I'm sure I've seen it.
Yeah, you expect your skin not to behave itself. You're not alone in this. Everyone goes through it, but there are things you can do to just do your best, and that's basically it.
Yeah, and that's what we're here to do, to help guide you and
Exactly.
help recommend.
Okay, so you're pregnant and you are planning your birth. You opt for a C-section, and the post C-section scarring is a concern. What can we do about C-section scarring?
Well, number one, you want the wound to heal up completely. So
Okay.
your obstetrician, the wound must be healed and closed. Obviously, the wounds in the lower abdomen, the risk of a hypertrophic scar or keloid scar is lower, but you can still get keloid scarring there, which obviously can look unsightly, but it often can itch and be uncomfortable. So that's where, as soon as the wound is healed, I would use a silicone gel and use it twice a day, because you can't predict whether you're going to develop a hypertrophic scar or a keloid scar. So it's easy to use. And we've got various silicone gels on Dermastore.
What does a silicone gel do, Dr. Webster?
It just occludes the skin. So it works just by occluding the skin. It prevents excess scar tissue. That's the way it works. It's very simple.
It keeps it hydrated.
It keeps it hydrated, yeah.
And so it prevents the buildup of collagen, so you won't get that raised scar. And to have sort of bandages or anything over it, you recommend it? Obviously, that being maybe a high friction area if you're wearing, you've got a waistline or lining on pants, just the silicone gel?
Well, you could put a bit of micropore tape over that if you wanted to.
Maybe initially.
You could put some micropore tape, yes. Obviously, it's an area that doesn't get much sun, so you don't need a sunscreen.
Well, unless it's summer and you're lying on the beach.
But the Caesar scars are quite low down.
Okay.
But you could put some. Obviously,
Sandy Bay.
you could put some micropore tape on top of it. Obviously, if the wound's healed well and you had a good surgeon, everything will be fine. But just the silicone gel is much easier. A lot of people, even though micropore tape or the paper tape is more hyperallergenic, but some people can react to the tapes, especially if they've had some sort of other plaster on. Sometimes the surrounding skin has become a bit irritated, and that's where the silicone gel is inert, and you basically can't react to it. It's very simple and easy.
And what's great about the silicone gel is it absorbs completely onto the skin, so it doesn't leave any residue or anything. It doesn't transfer onto clothes.
Well, the ones that we've selected on Dermastore are all dry touch, so they're fantastic,
Okay, so it's the big day, baby's out. Obviously, you want to be using the right products and techniques and having the right sort of advice from birth. We know how important, especially the skin microbiome is. What do you do?
Well, research has shown it's best to leave the vernix. The vernix is a covering that covers the baby at birth. It's a sort of a milky white covering, and research has shown it's best to keep that vernix on for at least 48 hours because it acts for the barrier function of the skin, but you don't want to bath the baby too soon because it can affect the baby's temperature, the core temperature. So research has shown leave it on for at least 48 to 72 hours, and then you can bath the baby. Obviously use the appropriate cleanser. Like on Dermastore, we've got Mastella. Don't use Aqueous Cream. A nice product like Mastella, and they've shown that if you put the baby in a little tub, a tub bath is better than a sponge bath because the big risk is you don't want to drop the baby's temperature.
Why is baby skincare so important? What is the need for a proper baby product and not just a normal body wash, for example?
So especially with people that have gotten what we call an atopic diathesis, in other words, a family history of asthma, hay fever, eczema. It's very important from birth to use the correct products. And obviously at birth, the skin is still developing. It's got a lower pH. The barrier function is not completely normal. So you just want to use a cleanser that's the right pH and just very gentle. That's not going to disturb the normal microbiome. And that's why this Vernix is also has got antibacterial properties as well.
So we're looking for products that are formulated, like you said, at the right pH, but that include the family of ceramides,
fatty acids.
Exactly.
Again.
So that's keeping the barrier
exactly. You want to preserve that barrier.
So,
okay.
Yeah, something at the correct pH that's non-stripping, non-drying. Also, interestingly, is the frequency of washing in the initial few weeks. I was told at our antenatal courses to only bath the baby once a week.
Well, I attended the EADV conference last year, and they said twice a week.
Okay.
Twice a week, and you will just wash the baby for 10 minutes, and in a little tub.
In a tub.
Not a sponge bath.
And the tub is because the water's staying warm. And,
exactly.
Okay,
yeah, exactly. You want to maintain the barrier function of the skin. You don't want to disturb that. And you don't want to disturb the microbiome.
And obviously certain products you would only start later, like sunscreens only from 3 months.
Yeah, even 6 months, I would say, maybe 6 months. So to do the sun avoidance thing.
Right. For how long, sun avoidance? Because obviously if you're going for a walk in the park and you've got a little one, I mean, what would you say from...
I would say it's up to 6 months.
Okay.
After that, I mean, obviously just... If they're in a pram, have it covered.
Yes. Have a little hat.
A little hat, yeah.
Okay, so sunscreens from 6 months basically could be.
Yeah.
Okay, so my little baby's now out the bath. We tend to, from seeing friends, love to lather their kid with these nice smelling body creams for their baby. How important is it? Are we looking for a specific body cream now that we're using for our babies?
Yes, again, it must be specially formulated,
Not aqueous cream.
Not aqueous cream, because the aqueous cream BP, the original one, a British pharmacopoeia, was made in the 60s, contains SLS.
Okay. Sodium lauryl sulphate.
Which has been shown with Professor Michael Cork. It's been shown that actually irritates the skin. It's doing more harm than good. So aqueous cream was originally invented or designed to be a wash-off product. Okay. It was never designed to be a leave-on product.
Thanks, Mom.
So use a special emollient like Mastella.
Okay.
And often what I find with these baby products is that they pack them with essential oils, which is also not great, I don't think, from an allergen perspective, from a skin barrier perspective. So we want to be one with nature, but actually all the skin needs is what the skin is. So that's essential fatty acids, ceramides, and your barrier supporting ingredients.
Yeah, exactly. So try and mimic the natural lipids in the skin. And again, they're good natural products and they're bad natural products. Like Mastella has a lot of natural products in it, like sunflower seed oil, avocado, but they've selected the good ones. And a lot of these essential oils, a lot of the ones with, so there's some ones that are not good, unfortunately.
So you've got to do a little bit of research around what we're using on our little ones now, and thankfully, we do have these options available on Dermastore.
I think that's been an awesome topic. Thanks so much to Ian and to Lara for today.
Don't forget to subscribe if you're keen to learn more about what we have to say. We would also really love your thoughts, ideas, and any questions you have for future episodes. You can email us on pod@dermastore.co.za.